This is a topic I've been wanting to share because I think it can really help people's quality of life. Although as a psychiatrist, I'm basically trained to not let people know about my personal information. This is especially true in the therapeutic relationship or in a therapy relationship. I don't want to let the patients know too much about myself because I'd rather the focus be on them in the therapy session. And also, if they know more about my personal life or what goes on in my life, that might affect the dynamics in the patient-doctor relationship. I think since the Google search and the internet has been so mainstream in this century, it kind of gets in the way of people's privacy. So I don't know if the same principles apply now. And so I decided to come out with this video just because I think teaching people about Lent, about fasting, about increasing their spiritual life is going to help them ideally with their life and hopefully with their mental health. So that's kind of the purpose of this video. Now, as a Coptic Orthodox Christian, we fast by abstaining from food and drink for a period of time in the day. And then also we fast, or meaning don't eat any dairy products, meat, or fish products during Lent. Now, I talk about fasting, including the scientific and medical aspects of it, and which sorts of people can or cannot fast in previous videos, which you can look at. This video will more look at some of the spiritual aspects, including what I plan to do during Lent to try to change some bad habits and focus more on developing good and virtuous habits. Now, fasting depends on one's spiritual level. It needs to be done ideally under guidance with a priest, someone experienced in fasting. And it's sort of a training that one can increase their fasting or their abilities to abstain from food and drink longer and longer, the more trained they are in these principles. Take, for example, some saints in the Coptic Church have been known to go days without eating just because they're so filled with their love from God or love of God, and they don't want to give in to the desires of the flesh. Because it's thought if you give too much to the desires of your flesh or your cravings, then it's going to be harder to practice habits like self-control. It's going to be harder to control one's thoughts, to control one's moods. Conversely, the better one is able to fast, the better one is able to control or redirect their thoughts, redirect their impulses like anger or sadness or impulses like that. Now, I'm not saying that people should fast or focus on the spiritual life and not focus on the psychological aspect or the mental health. Whenever there's mental health aspects like anxiety, depression, trouble sleeping that really impacts one's quality of life within their work or their relationships or school or some aspect, then it certainly needs to be talked about with a mental health provider. But for some people who are more functioning, and even people that are in mental health treatment, doing the spiritual component, going to church services, getting involved with the community, doing good deeds, has shown clinically to have a good improvement in one's mental health, whether they're suffering from anxiety, depression, psychosis. Better relationships with the family members are going to help with family dynamics, and that might help with certain mental health conditions like bipolar or psychosis. There's a nice quote by St. Augustine which says, "Fasting purifies the soul. It lifts up the mind and it brings the body into subjection to the spirit. It makes the heart contrite and humble, scatters the clouds of desire, puts out the flames of lust, and kindles the true light of chastity." In other words, fasting is going to help one to have self-control. It's going to help one to have better thoughts, kinder thoughts, be more gentle. These, I promise you, are going to improve one's life. And then when one's life is better, that's obviously going to have an impact either directly or indirectly on their mental health and their overall well-being. Personally, there's some habits of mine that I want to change during this fast or during this period of Lent. For example, I often tell patients to not use TV or be on their phones, stuff like that, at bedtime or while in their bed, because when you go to bed, you want to train your mind to think about just going to sleep. Although I'm guilty myself of maybe scrolling YouTube during bedtime or even sporadically during the day, and it's probably not that constructive for myself nor the community at large. And one aspect which I hear people do at night, which is really healthy and seems good, is to reflect on the day. the things that they did good, the things that they did bad, what they want to improve on, so forth. So I would rather replace the scrolling on my screen or watching YouTube or ESPN or some sort of sports, rather replace that with something healthier, such as reflecting on the day and its events so I can maybe improve the next day. Another aspect that, or a habit I want to sort of minimize or decrease, is watching sporting events in the evenings. I tend to watch a lot of basketball, and so maybe if I can replace that more with exercising or reading a book, or maybe working on a creative project that again might be better for not only myself but the community at large. And so typically when you have a habit that you want to break, it's important to replace it with a healthier, more constructive habit. And in the Christian faith, humans are limited. We only have so much ability in our life, and really we have to ask for Christ and God to come into our life to help us to have this control and ability over these habits and replace it with something more positive and constructive. And sometimes it can happen quickly, but for the most part, it's a journey or it's a process that sort of over time will gradually get better and improve and improve. So in other words, when you fast and you abstain from food and drinks and sort of limit those desires of your body and flesh, it's going to help reveal some of the inner thoughts and being of what one's soul is. Whether there's anger, whether there's hatred, or maybe it's anxiety or worries. These are particularly important to reveal or to bring out into the open and discuss, ideally in a safe place with, for example, a priest or someone in confession, at least according to the Orthodox faith. But this is also a true principle psychiatrically, because psychologically, if there's a dark thought or evil thought or something that you're thinking about, you need to share it out in the open with someone like a therapist in order to bring that into your awareness and make it easier to change those habits. But if you just let this thought or emotion linger, it's just going to grow bigger and bigger, and it's going to be harder to control or redirect down the road. So in other words, revealing the thoughts is going to help for the healing to come into place. This is nicely stated by St. Isaac the Syrian, where he says, "The patient who acknowledges his illness will have an easy recovery. Likewise, the one who acknowledges his pain or sin is close to recovery and forgiveness. As for the hard heart, its pain increases, and the patient who disobeys the doctor increases his torment." So the goal of this Lent is for us to be in tune with more our deepest and inner thoughts and being, and reveal it to the open, so ideally that Christ and God can help bring us health and healing. Hopefully you liked this video, and stay tuned for more about my journey and this journey to Lent, and hopefully people can find these principles helpful in their own lives and better their own spiritual health and overall well-being.